What if your body was whispering a warning? Would you hear it? Hello there. My name is Dr. John Smith, and for the past 4 decades, I've walked alongside thousands of patients in their 60s, 70s, and beyond. Through questions, through challenges, and sometimes through turning points. One of the hardest truths I've learned is this. Our bodies do speak to us, gently at first, then more urgently. But too often, those messages go unnoticed. Or worse, we hear them but shrug them off, hoping they'll fade on their own. If you've ever felt a strange shift in your body, something you couldn't quite explain, but told yourself it's probably nothing, this message is for you. Because the reality is, certain symptoms are not just quirks of aging, they are red flags. And when doctors like me see them, we know time could be running out. In this video, I want to walk you through 6 warning signs that may seem small on the surface, but could be your body's final plea for help. These aren't meant to scare you. They're meant to empower you because knowing what to look for might just save your life or someone you love. Let's begin with one of the most easily dismissed signs, and yet one of the most telling. Warning. Sign number 1, unexplained deep exhaustion. We all get tired, but there's a kind of fatigue that goes beyond normal. It's not the kind that follows a late night or a busy day. This is a weariness that feels like it lives in your bones. It shows up even after a full night's rest. It makes everyday tasks, walking to the mailbox, brushing your hair, holding a conversation, feel like climbing a mountain. I once had a patient, Eleanor, 74, who loved gardening. One spring she told me she couldn't even carry a small watering can anymore. I just feel drained, she said. No illness, no fever, just exhaustion. We ran some tests. Turns out her heart was struggling, quietly behind the scenes. Extreme, unexplained fatigue can be a sign that your heart, kidneys, or other organs are having to work harder than they should, or even beginning to shut down non-essential functions to preserve energy. So if you're feeling more than just a little tired, and especially if it's getting worse over time, please don't ignore it. Track it, talk about it, and bring it to your doctor's attention. Your body may be trying to tell you something very important. Let's talk about one of the most urgent messages your body can send. Chest pain. Now, not all chest discomfort is life-threatening, but when it feels heavy, tight, or like a crushing weight in the center of your chest, especially if it spreads to your arm, shoulder, jaw, or back, it's time to act fast. You may have heard people describe it as an elephant sitting on my chest. That's not just poetic. It's how many people describe the sensation of a heart attack. But here's the surprising part. Heart attacks don't always look like what you see in the movies. There isn't always a dramatic collapse or obvious clutching at the chest. Sometimes it's just a dull ache, or a sudden sweat, or a strange pain that travels down your left arm. And sometimes the pain isn't sharp. It's a pressure, or even a sense of tightness that slowly builds. For others, the chest pain may feel sharp or tearing, and that could point to something even more dangerous, an aortic dissection. That's when the main artery carrying blood from your heart begins to tear. It's rare, but when it happens, you only have minutes to act. Let me tell you about Samuel, 77. He thought his discomfort was indigestion. Just some heartburn, he said. But his wife, noticing he was pale and clammy, insisted they go to the ER. That decision saved his life. He was, in fact, having a heart attack. If you ever feel chest pressure or pain that doesn't go away after a few minutes, especially if it's new, severe, or combined with nausea, dizziness, or shortness of breath, don't wait. Don't lie down and see if it passes. Don't drive yourself. Don't brush it off. Call 911 immediately. When it comes to your heart, every minute matters. Getting help quickly can mean the difference between a full recovery and permanent damage, or worse. It's not about panicking. It's about listening when your body is shouting and trusting that it's better to be safe than sorry. Warning. Sign number 3, shortness of breath, even when you're not moving. Have you ever been sitting quietly, maybe watching TV or reading, and suddenly felt like you just couldn't catch your breath? No stairs, no exercise. Yet it feels like the air is getting thinner, or like you're breathing through a straw. That's not just getting older. That's your body sending you an urgent signal. Shortness of breath, especially when it appears suddenly or worsens over time, is one of the most important red flags doctors look for when assessing heart or lung issues. And for older adults, it could point to something serious. Let's break down what the symptom could mean. First, it could be a sign of heart failure. When your heart can't pump blood efficiently, fluid builds up in the lungs, making it hard to breathe, especially when you're lying down. Some people even wake up gasping for air at night. It could also be a pulmonary embolism, which is a blood clot that travels to your lungs. These often strike without warning, especially after long periods of sitting, surgery, or travel. The clot blocks blood flow and can be fatal if not treated quickly. And then there's the silent heart attack. This doesn't always come with dramatic chest pain. It might show up as breathlessness, fatigue, or cold sweats, and it's easy to mistake for something less serious. But ignoring it can be a deadly mistake. Meet Gloria, 74. She was folding laundry when she suddenly felt out of breath. No chest pain, no fever, just a strange tightness. Her daughter took her to urgent care, and it turned out Gloria had a clot in her lung. If we'd waited, the doctor told her, you might not have made it through the night. Here's the bottom line. If you feel short of breath for no clear reason, especially if it comes on suddenly, don't wait. It doesn't matter if it seems minor in the moment. Call your doctor. Go to urgent care. If it's severe, call 911. You know your body better than anyone else. When something feels off, listen, because the breath you save could be your own. Warning, sign number 4. Sudden, unexplained weight loss. Losing a few pounds can feel like a victory, especially if you're not even trying. But what if that weight loss isn't something to celebrate? What if it's your body waving a red flag? For older adults, rapid or unexplained weight loss, especially more than 5% of your body weight in a few months, can be a serious warning sign that something deeper is going on. Sometimes it's the very first symptom of a major health issue. Doctors often see this kind of weight loss in people who are silently battling cancer, especially of the pancreas, lungs, or stomach. These cancers can speed up your metabolism and reduce appetite long before other symptoms appear. Metabolic disorders like undiagnosed diabetes, which cause your body to burn through energy reserves far too quickly. Or heart failure, where the body struggles to absorb nutrients properly, leading to the loss of both fat and muscle. You may notice your clothes getting looser. Your belt fits tighter. People might say you look thinner before you've even noticed. But instead of feeling proud, you feel tired, weak, even a bit worried. Here's another overlooked cause: chronic infections and inflammation. Conditions like tuberculosis, autoimmune disorders, or lingering infections force the immune system to work overtime, draining your body's resources faster than it can replenish them. Let's take the case of James, 72. He hadn't changed his eating habits, but over just 2 months, he lost 12 pounds. At first, he thought it was a fluke, maybe stress, maybe aging, but his daughter urged him to see his doctor. Blood work revealed early-stage colon cancer. It was caught in time because they listened to that one early clue. So if you're losing weight without trying, don't ignore it. This isn't about vanity, it's about vitality. Your body needs strength to stay resilient. If the pounds are falling off without explanation, make an appointment. Ask for answers, because sometimes the scale tells a story your body can't say out loud. Warning, sign number 5, sudden confusion, disorientation, or personality changes. There's a quiet kind of fear that creeps in when your mind doesn't feel like your own. Maybe you, or someone you love, has suddenly started forgetting names, feeling lost in familiar places, or struggling to finish sentences that once came easily. Maybe their behavior shifts, agitated, withdrawn, or simply off. When these changes come out of nowhere, it's not just getting older. It could be something much more serious. Doctors know that sudden mental changes are a red alert from the brain. Often, they're tied to medical emergencies that demand fast attention, like a stroke, a brain infection, or even severe dehydration. Let's start with strokes. Not all of them come with slurred speech or a drooping face. Some show up as nothing more than confusion, hesitation, or trouble following a conversation. If this episode fades quickly, it might be a transient ischemic attack, TIA, a mini stroke that often warns of a larger stroke coming soon. Another overlooked cause, infections, especially in older adults. A simple urinary tract infection or pneumonia can trigger delirium, a sudden, dramatic shift in awareness or personality. And these changes can happen overnight. There's also dementia, which typically develops gradually, but can sometimes seem to arrive fast, especially under stress or illness. People who were once sharp and engaged might begin to lose track of time, repeat questions, or misplace things they've used for decades. Meet Lillian, 79. One afternoon, her daughter found her standing in the kitchen, staring blankly at the stove. She'd forgotten how to turn it on, something she'd done every day for 50 years. Within days, her confusion worsened. A hospital visit revealed a treatable brain infection, caught just in time. Here's the truth: sudden mental shifts are not normal. They are the brain's SOS. So what should you do? If you or someone you care about experiences unexpected confusion, disorientation, or changes in behavior, seek medical attention immediately. Don't wait to see if it passes. The earlier the intervention, the better the outcome. Because when it comes to the brain, every moment matters. Warning, sign number 6, deep, persistent abdominal pain that won't go away. We all get the occasional stomach ache. Maybe it's something we ate or a little indigestion. But when the pain runs deep, sharp, pulsing, or unrelenting, it's not just discomfort. It's a red flag waving loud and clear. Doctors know that severe abdominal pain, especially if it appears suddenly or sticks around for hours, can mean something in the body is failing, and fast. One of the most urgent dangers? A ruptured abdominal aortic aneurysm. This is when the body's largest artery, which runs through the belly, weakens and bursts. When that happens, internal bleeding begins instantly, and without emergency surgery, survival is unlikely. The pain usually starts in the lower stomach or back. Some people describe it as a deep, constant throb that seems to pulse with every heartbeat. Others feel a tearing or stabbing pain that doesn't go away, no matter how they move or lie down. Another life-threatening issue is intestinal ischemia, when blood flow to the intestines is suddenly cut off. It might be caused by a blood clot or a twisted bowel. At first, it may feel like a severe stomach cramp, but it can escalate quickly, leading to tissue death and even sepsis if not treated. Then there's pancreatitis, an inflammation of the pancreas that can cause burning, radiating pain in the upper abdomen, sometimes shooting through to the back. It often flares after meals and gets worse with fatty foods. And we can't forget the gallbladder. When blocked or inflamed, it can cause gallstone attacks, sudden stabbing pain under the ribs, especially after eating. Many people mistake this for heartburn or gas, but left untreated, it can lead to dangerous infections. So how do you know when abdominal pain is serious? Ask yourself, is it sharp, persistent, or unlike anything you felt before? Does it come with nausea, fever, vomiting, or weakness? Is your belly tender, swollen, or hard to the touch? If the answer is yes to any of these, do not wait. Seek medical attention immediately. These aren't just aches. They may be your body's last warning that something is breaking down. Catching the cause early can mean the difference between recovery and a tragedy. As we grow older, it's easy to dismiss the small changes in our bodies as just part of aging. But the truth is, your body is always speaking to you, sometimes with a whisper, sometimes with a shout. The 6 warning signs we talked about today aren't meant to scare you. They're here to remind you that your health still matters, that you matter. Because growing older doesn't mean giving up control. It means listening more closely, acting more wisely, and choosing to care for yourself with the same love you give to others. So if something feels off, don't wait. Don't explain it away. Talk to your doctor. Ask questions. Get answers. You have so much life left to live. And the more you understand your body's signals, the better you can protect the precious years ahead. If this video helped you feel more aware or empowered, please leave a comment below. Share one takeaway, or let us know which sign surprised you most. Your words might just help someone else. And if you haven't already, hit the subscribe button and turn on the bell. We're here every week with simple, life-changing tips to help you live stronger, longer, and with more peace of mind. Take good care of yourself, and we'll see you in the next video.